Hi, everyone. Thank you for joining our webinar today. I'm Vanessa Albritton, here to provide information on open enrollment and changes coming in the new year. Presenting with me today are Rob Jarzombek and Yesenia Croft. So we have several important topics on our agenda today. We're going to go ahead and get started. First, we'll review some key open enrollment dates. So next week, on Monday the 8th, health plan statements will be available in members' CalPERS accounts. They'll also be mailed to those whose communication preference is US mail. Also on September 8th, the Search Health Plans tool is live and updated with 2026 health plan information and premiums. Then on September 10th, we're hosting an open enrollment member webinar on YouTube. We'll cover 2026 health plan changes, open enrollment resources, and answer frequently asked questions. And like this one, the webinar will be recorded and posted to CalPERS YouTube channel for anyone who may have missed it. Encourage your employees to tune in for details tailored to them. Open enrollment begins September 15th and ends October 10th. You have until midnight on November 7th to finish processing all open enrollment transactions. Please make sure you adhere to this cutoff and don't put off processing enrollments because this can delay transactions to the carriers, which can lead to delays in members receiving their ID cards. So open enrollment is the one time of year your employees can make changes to their health benefits without a qualifying life event. During this time, they can enroll into a CalPERS health plan for the first time, change their health plan, add eligible dependents and or remove dependents, or cancel coverage altogether. And as the employer, you decide how you want your employees to make health enrollment changes. There is the option for them to use CalPERS, but it's not required. For employers who do take advantage of this option, here's a few reminders. When an employee changes their health plan online during open enrollment, you as the employer do not need to key the transaction yourself or even approve it. However, you will receive a notification that an open enrollment health plan change was submitted. Other transactions like new enrollments, adding a dependent, and some delete dependent transactions still require your review of eligibility and documentation before approving. And you can monitor all open enrollment transactions through on-demand Cognos reports, such as the Open Enrollment Health Plan Changes report. Again, use of the functionality is at the discretion of your agency. If you choose to use a different process, be sure to communicate that to your employees. So for those of you who use a third-party vendor or upload a file for your health enrollments, please ensure the member's demographic information you send on the file matches what is in CalPERS. If the demographics don't match, the file will error out. You'll have to correct the demographic information and resubmit, as we are unable to process these transactions. For example, if you're trying to add a dependent whose date of birth doesn't match what we have in CalPERS, you'll have to validate which birth date is correct and update that information accordingly before resubmitting your file. You can update this demographic information yourself directly in CalPERS. So last year, we got a lot of questions from our members about where to find dental and vision information. And we have a dedicated webpage with all this information here. So open enrollment for state and CSU sponsored dental and vision plans is September 15th through October 10th. So just like health open enrollment. State and CSU members can find links to these benefits and contact information on the dental and vision benefits page on the CalPERS website. Public agency and school active employees should contact their employer, and retirees should contact the agency or school district they retired from for any questions on dental and vision. Now let's cover the 2026 health plans and changes. First, we wanted to provide a snapshot of all the health plan options we have. So these are our basic plans. We have 10 HMOs. With an HMO, you get care only from doctors and hospitals in the plan's network. You usually pay smaller copays, no deductible, and won't deal with claim forms. Coverage is limited to a set service area. And then we have 2 PPOs, which allow you to see any doctor, but you'll pay less if you use in-network providers. There's a deductible, and you'll share costs through coinsurance. So the plan pays part, you pay part. And we have 1 EPO. With an EPO, like an HMO, you must use doctors in the plan's network. Unlike an HMO, you don't need a referral to see a specialist. You pay copays, but no deductible, and coverage is very limited to a set service area. The EPO plan is only available in 18 of the more rural counties in Northern California. There are also association plans, which are only available to members who belong to these associations and pay applicable dues. Each plan offers basic and Medicare coverage. So now for the 2026 updates, we have service area changes in Monterey County. So Blue Shield Access Plus will replace TRIO here. Monterey County members currently enrolled in TRIO will be automatically enrolled in Blue Shield Access Plus unless they make a change during open enrollment. Now we'll talk about our PERS Gold Basic Plans Value-Based Insurance Design, or VBID, which is not new, but has some updates for 2026. So VBID is a program that aims to improve health outcomes by encouraging preventative care and the use of health services while reducing member costs. With VBID, you can lower your inpatient deductible by completing healthy activities, which earn you credits. Each qualifying activity is worth $100, and members can earn up to $500 in credits per year. Dependents other than a spouse or domestic partner automatically receive all 5 credits at the start of the year. However, credits will not exceed $1,000 for a family. It's important to note that you won't receive a statement for this, so you'll want to track credits and monitor progress through the Included Health website or mobile app under the deductible tracker. So here's the expanded menu of activities for 2026. Complete a short depression or anxiety screening from your provider, which you can self-report through Included Health. Complete a preventative screening or receive an immunization. These can add up to a maximum of $400 in credits, and they're usually tracked through claims. You can also self-attest to a flu or COVID-19 vaccine through the Included Health app. Get a second opinion from a preferred provider or through Included Health before any non-urgent or non-emergency elective surgery. If you have a chronic condition like asthma or diabetes, for example, you may be eligible to participate in Included Health's care management program. Credit is awarded after an intake with a case manager. In 2026, credits won't be automatically applied for this. You will need to take steps to get a second opinion or participate in care management to earn the credit. If eligible, you can earn credit by participating in the diabetes prevention program. The credit is awarded once you've attended at least 2 sessions or engaged with the app within the first 2 months. And your provider will determine if you are eligible for the program. So the main things to keep in mind are that subscribers, spouses, and domestic partners must complete the activities themselves to receive credit. Other dependents automatically receive all 5 credits at the beginning of the year. However, the combined family credits will not exceed $1,000. You can track your progress and self-report some activities directly through the Included Health website or app. To learn more about 2025 and 2026 details, you can visit calpers.ca.gov/vbid. Now I'll turn it over to Rob Jarzombic, Chief of our Health Plan Research and Administration Division, to share a brief update on our new Pharmacy Benefits Manager and talk to us about the basic PERS Gold and Platinum PPO plans.
All right, thanks, Vanessa. And good morning, everyone. CVS Caremark is replacing OptumRx as the Pharmacy Benefits Manager for many of our health plans starting January 1st, 2026. Specifically, CVS will provide outpatient pharmacy benefits for the Anthem Traditional and Anthem Select Basic plans and Anthem's Medicare Advantage plan. CVS will also provide outpatient pharmacy benefits for HealthNet Saluti Mas, both the PERS Gold and PERS Platinum Basic and Medicare plans, Sharps Basic Plan, United Healthcare's Alliance and Harmony Basic plans, and finally, also for Western Health Advantage's Basic plan. This slide shows which plans will not be affected by our change from Optum to CVS. These plans are Blue Shield's HMOs, so Access Plus, as well as Trio, Blue Shield's EPO, and Blue Shield's Medicare Advantage plan. All of our Kaiser plans, so both basic and Medicare Kaiser plans, are also not affected by the change. Neither is Sharp's Medicare Advantage plan, nor is UHC's Medicare Advantage plan. Here are a few of the highlights on the PBM change, which applies to both basic and Medicare members. Pharmacy access remains similar, as most members can continue using their current pharmacy. There will be some formulary changes, and there may be changes to copays. However, the number of members affected by this is low, and members will still have access to the safe and medication that they need and receive today. There will be plans in place to ensure a smooth transition for filling prescriptions impacted by the formulary change and for an automatic transfer of approved prior authorizations. For Medicare members affected by the change, which again are those members enrolled in Anthem Medicare Preferred and the PERS Gold and PERS Platinum Supplement to Medicare plans, these members' pharmacy benefits will be administered by SilverScript, which is an affiliate of CVS. SilverScript and CVS work together, and really the only difference is branding and the appearance of the materials members receive. Today, we mailed a letter to all of our impacted Medicare members introducing SilverScript. We're in the process of updating our webpage with FAQs about this to avoid any confusion, and are targeting having those updates made by tomorrow. To learn more about the PBM transition and review a list of frequently asked questions, please visit calpers.ca.gov/CVS. We're also hosting a special PBM webinar on September 18th and encourage you to tune in. We'll share why we're making this change to CVS Caremark and have experts from our health team and CVS to provide an overview on the transition, including the various communications and resources available, and how we are supporting members through this process. You'll learn important information to share when asked questions from your employees. Also, keep an eye out for upcoming communications from CVS for basic plan members and SilverScript for Medicare members to ensure you understand what to expect in the new year. Now let's talk about CalPERS PPO plans. We often get questions about how our basic PERS Gold and PERS Platinum plans are different and how the benefits work, so we wanted to provide some helpful insights today. First, let's walk through a quick comparison between the PERS Gold and PERS Platinum basic plans so you can get a sense of the key differences. With PERS Gold, the service area is limited to California, so it's designed for people who mainly live and get care within the state. It offers lower monthly premiums compared to PERS Platinum, which can help save on upfront costs. However, you may face higher out-of-pocket costs when you use your care in the form of deductibles or copays. But as Vanessa mentioned earlier, participating in health activities can help lower your inpatient deductible. Overall, this plan is ideal if you're comfortable with those trade-offs and your healthcare needs are mostly within California. The coinsurance for this plan is 80/20 in-network, meaning the health plan pays 80% and the member pays 20% of the allowable amount for services received in-network. However, once a member reaches their maximum calendar year coinsurance responsibility, the plan pays 100%. Now, PERS Platinum. This plan provides coverage nationwide and even internationally, so it is much broader than PERS Gold. The monthly premium is higher, but the advantage is that you'll usually have lower out-of-pocket costs for services, so things like deductibles, copays, and coinsurance. PERS Platinum is especially good for people with ongoing significant healthcare needs or those who travel frequently or live outside of California. The coinsurance for PERS Platinum is 90/10 in-network. So the plan pays 90% and the member pays 10% of the allowable amount for services received in-network. Once a member reaches their maximum calendar year coinsurance, then the plan pays 100%. And I'll talk more about coinsurance in a moment. This slide digs a bit deeper into the basic PPO benefit design. This is not a comprehensive list, but represents some of the more common covered services. You'll see here a column for the HMO benefits as well for comparison. These benefits are generally the same across all HMOs, and there's no deductible or coinsurance with HMOs. So let's focus on the PPO benefits and the differences between PERS Gold and PERS Platinum. With the PPOs, there are deductibles and coinsurances for covered services. When receiving care in the preferred PPO network, you'll pay the 20% or 10% coinsurance depending on the plan. When you receive care out of network, you pay more. The deductible is the amount you pay before your insurance pays. As you can see, your deductible is lower if you receive services in network, which is why we encourage everyone to see preferred providers in network. And an important note here is the in-network and out-of-network deductibles are counted separately. So if you see a non-preferred or out-of-network provider, the amount you pay does not count towards the in-network deductible. Once your deductible is met, your coinsurance comes into play. Coinsurance is a percentage of the bill you share with your plan after your deductible is met. This is the 80/20 and 90/10 split I mentioned earlier. With PERS Gold and PERS Platinum, there's a maximum calendar year amount you're responsible for before the plan begins paying 100%. However, if you go out of network, the amount you pay for those services does not count towards the amount you're responsible for, meaning it will take longer to get to the point where the plan pays 100%. In contrast, with an HMO, you cannot go out of network to receive services. If you do, you are responsible for the total cost of the services provided. The HMO plan does not pay any portion. For a detailed breakdown of all the benefits across all of our plans, we encourage you to review the health benefits summary. You'll also find this information for each plan in their individual evidence of coverage documents. And if you have more questions or need assistance in navigating your PERS Gold or PERS Platinum basic plan, please call Included Health or visit their website. Included Health will help you keep track of your deductible and coinsurance progress, help you understand your benefits, match you with a doctor, and help you understand your claims if needed. Now I'll turn it back to Vanessa to talk about open enrollment resources we have available to help you with your employees' questions.
Thanks, Rob. So new this year, we have a centralized location where employers and members can access all open enrollment resources. This is a screenshot of part of that page, which provides information to help members prepare for open enrollment. Explore their health plan options to shop and compare plans and premiums, learn about programs like behavioral health and wellness, and find a variety of publications. Each year, we update our 3 health publications. The Health Benefits Summary provides a general overview of health benefits and compares covered services, co-payments, and benefits for all plans. The Medicare Enrollment Guide, which was enhanced for readability this year, provides information about how Medicare works with your CalPERS health benefits. And the Health Program Guide, which was enhanced last year, describes basic health benefits, eligibility and enrollment, and how life changes or changes in your employment status can affect your benefits and eligibility. So next, I want to share the various ways we communicate to your employees. We started sending open enrollment emails in July and will continue to send information through September. Because we send a lot of communication through email, it's important that your employees keep their email address up to date in their MyCalPERS accounts. So in addition to email, we routinely share open enrollment information through our perspective blog posts, social media, and letters. This year, we mailed letters to members affected by this change to CVS Caremark, those who are in a plan with a premium increasing 9% or more, and Monterey County members enrolled in Blue Shield Trio. One of the key resources for you is our open enrollment for employers page. This page has all the information you need for a successful open enrollment. Here you'll find information like open enrollment health fair resources, links to everything I just covered, including copies of the member letters. And for our state employers, information regarding CalHR and CSU's virtual benefit fairs. And this is all communicated to you through employer bulletins. If you're not signed up to receive these bulletins already, be sure to do so through the email subscriptions page on our CalPERS website. For open enrollment, the employer bulletins provide information and links to many of the questions you'll get from your employees. Now I'll turn it over to Yesenia, Chief of our Health Account Management Division, to talk about the various ways you can engage with us.
Thank you, Vanessa, and good morning, everyone. We have several different ways that you can stay up to date with CalPERS. The Board of Administration and its committees meet throughout the year, and we encourage you to watch live webcasts of open sessions or view the recordings on YouTube page. Tune in to the Pension and Health Benefits Committee in September and November. This November, the 2027 health program proposals will be presented to the Pension and Health Benefits Committee. This is a great opportunity to hear firsthand what's in the works for 2027. The Employer Leadership Dialogue is another great way to stay up to date. You will find me at these forums providing updates on our health program, and you'll also get updates from other leaders on pension and investment topics. The dates and locations can be found on our website. And lastly, the stakeholder engagement briefings are typically held the Thursday prior to board meetings. This is another great way to preview committee agenda items and share your input with us, the health teams, and our stakeholders, our stakeholder teams. And now some key dates. This is a handy calendar of upcoming events that I hope you will find helpful. And coming soon is our biggest educational event of the year. The CalPERS Educational Forum will be held October 13th through October 15th in Palm Desert. This is a great chance to learn more about our CalPERS benefit programs and services through informative sessions. We'll have many exhibits there, and then one-on-one consultations with subject matter experts. Registration is still open and can be found on our employer education page. And now I'll pass it back to Vanessa to guide us through some frequently asked questions.
Thanks, Yesenia. So this year we took a different approach with our Q&A section. To answer as many as possible, we asked for your questions in advance. This allowed us to organize them into categories and have our team of health experts provide answers. So the first category is general open enrollment and systems questions with Anthony Williams.
Hi, thank you. Okay, so our first question is, do members need to do anything if they want to keep their current health plan? And the answer is, members do not need to do anything if their plan is still available and they want to keep their current health plan. Our second question is, how can members confirm which health plans accept their provider or medical group? And the second part of that question is, how do members know if their primary doctor, specialist, or group that they prefer are covered by a specific health plan? And the answer is, the Search Health Plans tool is the perfect resource to check which health plans accept their provider or medical group. They can provide the name of their primary care provider or specialist, as well as a medical group, and the tool will list whether or not the plan in their area accepts that provider, along with satisfaction ratings. Members are always encouraged to confirm any availability directly with the carrier before making any change. All right, and our next question, what health plans offer health and wellness programs and other perks? And what kinds of benefits are offered, like gym memberships, nutrition classes, and behavioral health, et cetera? And the answer to that question is all of our health plans offer health and wellness programs along with other various perks. These benefits can include, but they're definitely not limited to, gym memberships, health and nutrition classes, wellness coaching, discounts on several different wellness activities and memberships, including acupuncture, individual and group therapy, and more. All of these offerings vary by plan, so be sure to check out the details at www.calpers.ca.gov/health wellness programs. And our next question, how can members compare differences between health plans? Also, the Search Health Plans is also a great tool to compare differences between plans. Once a search has been made, members can select up to 3 plans to compare copays, deductibles, out-of-pocket maximums, etc. And one helpful feature you can utilize is to actually filter the results by only the differences, which is pretty helpful. Additionally, the plans and rates page on the CalPERS website has additional information, such as links to the health plans websites. The forms and publications section also has information such as the EOCs and the SBCs, which is the summary of benefits and coverage, to help provide detailed coverage information. And sort of a follow-up to that is where are publications and EOCs found? And the answer to that is all of our carrier-specific publications and EOCs, which outlines the costs and benefits of your plan for that specific year, are found on the CalPERS website in the Forms and Publications section. And that's located at www.calpers.ca.gov/forms-publications. All right, next question. How will employers be notified of a file airing out if demographics do not match what's in my CalPERS? It says, you will be notified of demographic errors in a response file placed in the Secure File Transfer Protocol, which is SFTP folder, where you submitted your enrollment file. This response file will specify which transaction encountered the errors and provide details on the demographic issues that caused the errors so that you can resolve them and resubmit your file. The next question, when will Cal HR benefits calculator be updated to include 2026? This one's specific for our state members. The Cal HR benefits calculator is slated to be updated with 2026 information by the first day of open enrollment. And then the last question for this section is, if our agency decides to use our own online platform for employees to submit open enrollment elections, do we still have to require employees to submit a paper HBD 12 form? And the answer to this is, if your agency decides to use your own platform to submit open enrollment elections, you do not need to require employees to submit a paper HBD 12 form. However, you do need to collect all the information contained on the form and be able to provide the information upon audit request. And all of this information is contained in a circular letter 600-010-19, and that is dated February 25th, 2019, along with all of our other circular letters that are archived. And that's all the questions for my section.
Thanks, Anthony. So now we have Richard Ramsey to answer some questions around enrollment and eligibility.
All right, thank you, Vanessa. So the first question I have, is a provider medical group contract termination a qualifying event to change health plans, and why not, if not? And the answer to that is no. Unfortunately, that is not a qualifying event. Changes to medical groups and contract terminations occur often and throughout the course of the year. And so these are not qualifying events to change health plans. Most of the time, the contract negotiations are successful, and they do negotiate a new contract, and the services are maintained. While we understand that there's some confusion and anxiety created by these events, as a purchaser of healthcare, CalPERS cannot guarantee you will be able to indefinitely continue your relationship with your provider if your provider or health plan ends their contract. It's also important to note that the California Department of Managed Healthcare requires that health plans have sufficient providers available in each health plan network at all times to provide services to all members. And then also, if a new contract is negotiated successfully or not negotiated successfully, and you are in a course of treatment, you are able to request a continuity of care plan to complete your treatment with your provider. And then once the treatment is completed, you will receive services with an in-network available providers. And if members are not satisfied with their access to healthcare, they can appeal to CalPERS in writing, and these will be evaluated on a case-by-case basis. And then the second question I have, permitting events. So when can members change health plans when they move? And then what are the type of events that will allow you to change your health plan? So moving is a qualifying event to change your health plan. Other qualifying events include retirement, Medicare eligibility, and open enrollment. And for any of these qualifying events, a separate open enrollment, you have 60 days from the qualifying event date to request your health plan change. And then the third question I have, if a member's child is disabled, what paperwork is needed to add that child after 26 years of age? So with disabled children, they are to be enrolled at the time of the initial enrollment, or they are to be continued on the member's enrollment from before age 26 to be eligible for our health program. The required paperwork would be our disabled dependent member questionnaire and medical report, which is also known as the HBD 34. We also have an authorization to disclose protected health information, which is BDS 35. And this is just a form to authorize the doctor to release the information. We do not need that form back. It's just for the doctor. And then the disabled dependent medical questionnaire and medical report has a portion for the member to complete as well, and a portion for the doctor. And once the doctor completes their portion of it, they would have to send it directly back to CalPERS, either by fax or mail. And all the instructions are on that HBD 34 form. And that form can be found in our forms and publications area of our website. And then the next question, is it eligible or is it possible to add a parent as a dependent with health insurance due to a loss of coverage? And then who is eligible to be a dependent for health coverage? So unfortunately, parents are not eligible for employer-sponsored health plans. Eligible dependents include spouses, registered domestic partners, natural and adopted children, stepchildren, and children that you have assumed a parent-child relationship with and are considered the primary parent, and certified disabled dependent children age 26 and older. And then for my final question, now the question is, I am retiring in October, and I understand I am covered by my same plan, which will transition to a Medicare plan December 1st. But if I want to change my health plan, does it have to be effective 1/1/2026 for open enrollment? So Medicare eligibility and retirement are both qualifying events to change your health plan. Under this scenario, you can change your health plan effective December 1st with a qualifying event of retirement or Medicare eligibility. And then just as another scenario, some members actually change their health plan when they retire and then later become Medicare eligible and change their health plan again. So those are both qualifying events to change your health plan. And that concludes my list of questions.
Thank you, Richard. And now for our final categories, Rob will answer some questions related to health benefits and the pharmacy benefits transition.
All right, sure. So the first question we have, which is an extension of Richard's first question, is how often and when during the year can a provider or medical group negotiate their health plan contract? And the second part of the question is, can members be notified prior to open enrollment to make an informed decision? So as far as negotiations go, most provider and medical groups are negotiating multi-year contracts lasting typically 3 years, but they can be anywhere 1, 2, or 3 years. With these contracts, their effective date is all over the place. It can be any time of the year. And so unfortunately, that timing does coincide with open enrollment where members may not know exactly if the plan will be or the medical group will be in network on the following year. So we don't have control over that because there's different open enrollments through different types of purchasers throughout the year, as well as CalPERS does not have that contract actually with the medical group. We have our contract with the health plans. And so what we use, and we've been telling our health plans this, is to really keep the members out of the middle of the negotiations. And so this is where we don't want our members to be like really the bargaining chip with this. And also we want to have clear communications from the plans as well as the entities they're contracting with to produce clear communications to members. We know this creates uncertainty in those situations, and we really work hard to make sure that we have clear communications coming from the health plans at that time. The good news is, as Richard mentioned, is that the vast majority of all of these contract negotiations do actually result in a new agreement. And so while there's times where they go dark for a little bit, or like a window of a few weeks, that is typically not the case. And there's typically a new agreement before the previous agreement expires. As far as members being notified of that decision, again, it doesn't always coincide with open enrollment, and so we're not able to do that. However, when there is a potential termination, the DMHC has their own notification guidelines where members need to be notified 30 days in advance in an HMO that their PCP may be coming out of network. And so that is the notification that happens from the health plans. On the PPO side, it's not an advance notification. It is a notification within a few days of the termination happening between the health plan and the provider. So the next question we received was, do members have health insurance when temporarily traveling outside of the United States, and what does it cover? So yes, for members who may be temporarily traveling outside of the US, they can receive urgent or emergency care. Depending on where this happens, they may need to pay up front and then submit a claim to their health plan for reimbursement. So members should check their evidence of coverage or EOC for specific information and the phone numbers and websites prior to traveling so they know exactly who to contact should something like that happen to them. The next question we have is about changing health plans and how does a member select a new PCP with their new health plan? And then will their medical records and prescriptions be transferred over to the new provider and to the new health plan? So if a member changes health plans either during open enrollment or through a qualifying event, the members will need to review the new plans in-network provider list online and then select a new in-network PCP there, or by simply calling the health plan's member service line and asking for assistance in selecting a new in-network PCP. If a new in-network PCP is not selected, one will be assigned to those members in HMO plans. Medical records can be transferred by requesting them from the previous provider. And so you may need to submit a medical release form. And so the health plan will be able to determine if you need to do that or not, and if it includes the pharmacy benefits and pharmacy transfers as well. So we really encourage members to work with the new health plan they're going to ensure everything is transferred appropriately. Another question that we had was about pre-existing conditions. So do pre-existing conditions affect health coverage or the ability to change plans? So the short answer is no. CalPERS health plans comply with federal and state laws, including the Affordable Care Act. And under the Affordable Care Act, or ACA, health insurance providers cannot deny coverage or charge higher premiums based on pre-existing health conditions. So CalPERS health plans provide guaranteed coverage to eligible members regardless of their health status or pre-existing condition. Another question we received was about the value-based insurance design, or VBID, that is part of the PERS Gold plan. So what are all the ways the PERS Gold deductible can be reduced, and where can I find this list, and where can I complete a smoking attestation? So as Vanessa covered in her portion, starting in 2026, the smoking attestation credit will no longer apply to the PERS Gold inpatient deductible. In 2026, more vaccine options and expanded screening choices to promote healthy habits and support overall well-being have been added. These enhancements provide members with greater opportunities to take proactive steps in managing their health while earning credits toward their inpatient deductible. For 2026, as Vanessa shared, members can earn up to $500 in credits by completing various activities designed to promote preventative care, care of chronic conditions, and overall well-being. To view everything about our value-based insurance design, you can do so on our website at calpers.ca.gov/VBID, or VBID. And the last question I have for the health benefits section is regarding included health. So is the included health healthcare provider search tool on their website and app more up to date to provide broader provider results? So the included health search tool is routinely updated and shows a different view than what the Blue Shield website may show. So Blue Shield's website will provide an entire list of all providers available, whereas included health app shows more of a tailored version based on the medical information that they have through your medical claims about you. So it is not the comprehensive list. It is something that is tailored based on the information that they have. For the comprehensive list, you should visit Blue Shield's website. Then the second part to that question is the registration requirement in order to use the search tool removed for open enrollment. And so registration is required to use the included health provider search tool included during open enrollment. However, you do not need to have a registration to use the Blue Shield website, and you can also use our website to actually look up, find your doctor and see which health plans they're available in, which again, that does not require a registration. You can do it in your MyCalPERS account, but you can also do it on CalPERS website. Now moving on to the Pharmacy Benefit Manager, or PBM questions. Will members be able to view the formulary and to see which drugs are covered and their costs? And will this information be available during open enrollment? So yes, so both our basic and Medicare formularies will be available for members to view on the CVS and CalPERS website during open enrollment. So the formulary will provide the tiering for each drug, and those tiers determine the copayments. So tiering can be found in our health benefits summary guide. So yes, the information will be available for open enrollment. The next question we have is, will members continue to have automatic mail order prescriptions? And so yes, so the mail order, so members will still have the opportunity to have automatic mail order prescriptions, but it will continue as an option and not as a requirement. And so most mail order prescriptions will transfer automatically. That's what we're setting it up right now. But the member can choose to change that once we're with CVS next year to change it to a different channel. So whether it's going from mail order to picking it up in person at a local pharmacy. Next question we have is about, will members be able to get 90-day prescriptions at the pharmacy instead of mail order? So this question is yes. Both our basic members will be able to get the 90-day supply of any medications through the mail or through retail pharmacy, which is a little bit different from what they have today. This was always the case for Medicare members. The Medicare members were always able to get the prescriptions at the local pharmacy. And then I think the final question I have is, will members still be able to use OptumRx And so no, with CalPERS is changing our pharmacy benefits manager for all of our members over to CVS, who will start with as our new pharmacy benefits manager starting 1/1 of 2026. So that concludes my questions. Vanessa?
Thanks, Rob. And once again, to learn more about the pharmacy benefits manager transition, which affects certain plans, which we covered, be sure to join us on September 18th at 10 a.m. For our webinar with CVS. A reminder will be emailed as we get closer to that date. And that concludes our presentation. All of the questions answered today will be posted online next week. So we'll notify you of that as well. And then tomorrow we'll send you an email with a link to a short survey about our webinar today. Your feedback is very important to us and helps us plan for next year. So be sure to share your thoughts with us. And thank you all for joining. Appreciate your time. Looks like we'll give you back about 14 minutes. Have a great day, everyone.